pointer with laser pointer. Yeah. Take it. I got it. Hi again. Good afternoon, ladies and gentlemen. So I want to continue to another topic after the plastic abdominal. So now we would like to talk about the new approach to salvage vision in blindness patient due to filler injection, a series of 18 cases. So my name is Nguyen Hong Ha. I'm from Hanoi, Vietnam. Just call me Dr. Ha, like Hanoi, because if you call me Nguyen, the family name in Vietnam we have a 20 million Nguyen. So just call Dr. Ha. Yeah. So you see that with the more increase of the filler and Botox and filler everywhere. So now even in every people can do filler. So we have the blindness patient, and until now it's very difficult to treat this kind of complication. I imagine that you do the filler and the patient is blind, so you lose everything. You lose your job, you lose your home, and you risk to go to prison. So how can we do with this kind of treatment complication? You see that in Vietnam, it has a year. 5 years ago, it have a moment we receive 10 blind cases per year. So it's a lot. And normal, the people now, they go to the spa or hair salons for haircut to do the filler with the cheap filler. And the spa have no training and they blind. And when they blind, they go to see the dermatologist. But the dermatologist says that, no, I don't know how to do it, so go to see the eye doctor. And the eye doctor always do the retrobulbar injection, but it doesn't work. It's not always very good treatment. So why is the reason? Now they refer the patient for the plastic surgeon. So I come from the Việt Đức University Hospital. And I explained to you that my hospital is the biggest surgical hospital of Vietnam with 2,000 beds just for surgery. And our center now is also accredited by the Royal College of Surgeons. And we just to have received the 3 doctor plastic surgeons from Indonesia. I come to visit to observe our surgery last week. And we receive a lot of filler complication. So before the congress, also participate for the dissect cadaver here, and you know that in this class we see all the anatomy. You see the artery, the temporalis artery, the supratrochlear artery, and to prevent the complication. But in Vietnam, we don't have a chance to go to class like that. So how my resident learn about the anatomy? Here you see. We have a lot of women with very long hair, and all the hair falling in rolling machine. In take all the hair out, and you see the spoon. And it's good time to learn anatomy. You see? The artery is the superficial artery. And it's the supratrochlear. And you can see here is the temporalis artery. You cannot to inject your filler here because it's dangerous. And here you see the supratrochlear. Okay, so after learning, you need to resuture because you need to respect for your patient. That's it. So you need to put everything together and need to suture very small artery. It's only 1 millimeter artery and vein, but you can suture. The skin can survive and the hair regrow again. Let's see. Oh, sorry. So this girl, they come to see us with no hair, and after 4 years, she come back to invite me to go to her wedding, and her hair continue to be long to her leg. You see that she don't learn any lesson after the accident. She don't learn any lesson. And here you can learn a lot of anatomy. On the face, mouth, and lip, and eye, funnel, and you need to fit it. And you learn anatomy, and you learn everything. And you see, here I have no ear. So how can, because the ear not in the face. Yeah, but we also have the earphone down. You cut it, and then you need to fit it. And the people think that it's impossible because of the vascular in the ear is very small. But in fact, you can always find the artery and suture. And handsome guy. Yeah. But for the kids, these kids have no ear and no spoon for re-implant because it's eaten by the two dogs. It's two big bulldog. It owns the kid head and ear. So you need now to do the surgery for ear reconstruction. For the kid who have no ear, we need to do the ear reconstruction. Yeah. So before you do the rib, when you take the rib, you need to 2 or 3 surgery. It's very painful. So now I do is method. So I can do for one step. Yeah. You see, I do the one step. I touch the superficial arterial flap and to cover the method. So after one surgery, I have a year. You can see, very happy, no pain. Yeah. And then you can learn also a lot of anatomy. You see, is the temporalis artery. Yeah. Yeah. And you don't want to inject in this artery. It's Unstein. And it's a lot. It have no only one that you learn in anatomy. They say that it have one superficialis, but in fact it can have a 10 branch. And if you pick one, you blind. So be careful that you see this. Yeah. So when we do the endoscopic, you see endoscopic surgery for the ear. You see the artery and you see even the small air in the artery. But the way people have no blind because it's not filler. But if the filler in your artery, the problem why you are blind because it's after the blood cell come to stay with your filler and it make very big the embolism and then from beginner you have no blind but later you can be completely blind. It's also so now the treatment you treat the filler and also the blood clot. Not only hyaluronidase is good enough. Yeah. So come back to my hospital. It have a week. I receive a 3K applied on it per week. You see, all these 3K. I have a voice. Make the voice, please. You have no voice, right? Yeah. Right. Yeah. So this gun for the no. This gun also for the no. Yeah. What's the and owned by Canwin. So Canwin is not safe, owned dangerous, but owned is blind. And how can we do? Yeah. So before when we do retrobumbar, it doesn't help. But now we find why it not work. Because some people do the retrobumbar. Let's see. We try to do the retrobumbar. Yeah. You inject in the eye. We hope that it can help. Yeah, but it doesn't help because the patient still blind. Yeah. Here you see. But it's not dangerous. If we training, we can try because if you have a done as a solution, you can do the retrobumbar. We have a learn anatomy. Yeah, we try to put it. Yeah. And you see, and you cut it. Your needle all the way out of the globe. So no worry, you need to learn how to do the retrobumbar. It can save at least for the muscle around the ear, around the eye. Yeah. If not in the eye. Yeah. So why your retrobumbar is not always work? Because the central retinal artery, we do the super selective dissection. And you see the central retinal artery is only 0.4 millimeter and it stays in durameter. Yeah, very thick membrane. So hyaluronidase cannot infiltrate in the central retinal artery. So now I change the solution. I find a new method, try to find the ophthalmic artery. Yeah. So now we go to the microcatheter in the femoral artery. And from femoral artery, we can go to our and you can go to the heart, and you go to the internal carotid, and you go to the brain. And from the brain, you find the ophthalmic artery, and you do the hyaluronidase directly on the ophthalmic artery. Let's see. And now we have a do for 24K, 22K, and we save the vision for 18Ks. Let's see. This case come 4 hours after blind, and he come and we do the technique. You see, you put the microcatheter on the femoral artery, and you go to the heart, and you go to the brain. You see, the catheter to the brain. And when it go to brain, you see the brain, but you don't see the eye bone here. So the eye bone is not filling the blood, is the patient is blind because no blood to the eye. Yeah. Here you see the microcatheter go to the brain, but don't go to the brain. You need to go to ophthalmic artery. You need to turn left. Yeah, you see the microcatheter. Very difficult to find the ophthalmic artery, but you can finally, yeah, you can go inside. See? Yeah. When you find the ophthalmic artery, you see? Here, you see the ophthalmic artery, but the no eye bone. So it's the occlu here, and the patient blind. And after 2 hours, we do the hyaluronidase in ophthalmic artery, and you see the eye here. Yeah, and at this moment, the patient says that, okay, doctor, I can see you. Thank you. Yeah, let's see. Yeah. I don't have a voice. Where's the voice louder? Yeah, she can see my eye, she can see my glass, because it's 5 years ago during the COVID, every people have a mask. But say, oh doctor, I don't see, but I see your mask. So she can count my finger. Yes, like after the yes. Yeah. So after 3 months, you see, from blind, and she can see everything normal. She can come back to work in the bank. Very happy girl. Yeah. Now another girl is only 17 years old and get blind totally. Yeah. And you do also the same technique, and you see the angiography is the internal carotid, is ophthalmic artery, is occluded. You see the red arrow, nothing here. But after every 5 minutes, you see the ophthalmic artery become longer and longer. Yeah. So after the 2 hours, when you see the eye, the girl also says, okay, doctor, I can see you. That's finished. Yeah. So discussion. It have a lot of option to save the vision, but not really efficacious. So now we propose a multidisciplinary emergency, and we now do for more than 20K this technique, and no K have a complication. Yeah. Let's see.
New method to manage the filler-induced blindness complication. This 2K all suffer from ophthalmic artery occlusion following filler injection. This woman was admitted too late and you could not apply the method, which led to rupture eye 20 days later. This man was admitted earlier, was treated with new method, and then regained his vision and eye movement.
Yeah. So it means that if the patient come late, you need to treat to try. If you cannot save the vision, you can save the eye bone and the movement of the eye. And for the girl, we don't do it. So you see, after 20 days, one eye is smaller, so the eye is broken. And now she need to remove the eye and put the prosthesis, and very, very ugly. So I think that even the patient come late, we always need to try the technique, not save the vision, but have a 2 eye look more beautiful than 1 eye. 1 eye is that go to be the piras. Yeah. So we also have another girl, you see, come from Japan, come to Vietnam, because when she blind in Japan, she wait for 1 day, 2 days, she cannot see anything, she become totally blind, and the doctor says that, okay, if the filler is a good quality, perhaps it can help, but if the filler not good quality, so you are blind. So they take the flight and go to Vietnam. So after 5 days, you see her eye, when she come to see me, and then we do the technique. Yeah. So after 10 days, she can start to see. Yeah, not very clear as you can see. You can see her family. Yeah.
Sorry, Dr. Ha, you have 5 more minutes.
I finished. Yeah. Yes, you can see every film. Yeah. Yeah. So conclusion. The filler injection in double blindness is a severe condition. But when we apply the multiple discipline emergency, you need to use the intra-arterial thrombolysis. We need to combine hyaluronidase with the thrombolytic agent because it's not only the filler, it also the embolism with the blood clot not. It have no indication, even no contraindication, even patient come late, but you need to try your best, multidisciplinary, to be safe, effective, and help to improve the vision and keep the preserve the eyeball with very minimal risk. Yeah, so I would like to invite Nas Thai to come to Vietnam to visit us, and the country is beautiful and everything is cheap. Even the hotel in Vietnam is a half price of hotel here. So another Thai come to Vietnam. Thank you very much for your attention.
Okay, thank you so much, Dr. Ha. Next session is about arm rejuvenation. Please welcome Dr. Ruth Machiro Varela from Brazil. Please give applause to Dr. Varela.